Hey everyone, this is Crystal Lee, aka the Clinician Coach, and we're continuing our discussion on marketing for your private practice. So this week I wanted to talk about presentations, and when I talk about presentations, there are two kinds of presentations I'm talking about primarily. So one being the professional or referral source facing presentation, and the other being the community or audience facing presentation. So they're pretty much what they sound like. The professional or referral source facing presentation, that is like your CE or your conference presentation or doing trainings at community mental health clinics, that kind of thing. So you're getting in front of other professionals who may be potential referral sources for you. And the other kind of presentation, the community or audience facing presentation, is exactly that. You're getting in front of potential clients, so the audience that you want to get in front of. So those are often at schools or local community organizations, that kind of thing. And one is not better than the other. You want to choose based on what your marketing plan and your marketing strategy is. So if your marketing strategy or plan is more focused on getting referrals from other trusted professionals, then yes, the professional presentations are the way to go. And if your marketing strategy is more based on getting in front of your audience and potential clients, then absolutely, community-based talks are more useful for your marketing. And one is not better than the other. It really just depends on what your strategy is. And the reason why I suggest doing one versus the other, at least in the beginning, is because it does take a fair amount of work to start building those connections and getting your foot in the door and booking those presentations. So when you're kind of targeting two separate things, it just means your efforts are a little divided. So it's easier to focus on one or the other and kind of put all of your effort towards that, build some momentum, and then kind of switch focus to the other if you want to. And why bother doing these presentations? Because it is a fair amount of work. You have to build the relationship, you gotta book the thing, you gotta pitch, and then you have to do the presentation itself, and most often, especially in the beginning, you're doing it for free. So what's the point? The point is to build relationships, but to also position yourself as an authority in whatever field you're in. So for me, I do a lot of presentations related to autism, neurodiversity, transition to college, transition to adulthood, and that kind of positions me as more of a expert in those areas. So for you, think about your specialty, what your niche is, and then trying to position yourself as kind of the authority in that area. So if your specialty is eating disorders, like really getting out there and doing a lot of talks about eating disorders. If your specialty is trauma, really getting out there and doing a lot of talks about trauma. So it's also a good resume builder, something you can put on your website, helps build a little more of that trust factor. But really, if you're getting out there in front of the audience, that really helps with name recognition. So people are getting exposed to you. Hopefully they will like you. If you have a good solid presentation, they'll begin to trust you and know you, and some people will actually follow up with you afterwards, or after your talk they'll come up to you and talk with you a bit. You get to pass out your card, that kind of thing. So it really is a good marketing tool, but it's not for everyone, obviously. So let me know if you've done any presentations, what kind of presentations you might want to do, or even if you have like a topic in mind that you want to do, let us know. I think it'll be exciting to support one another. All right, thanks, bye.